This presentation provides a basic overview of upper limb prostheses for support workers. This presentation will cover amputation levels and types of prostheses for upper limb amputees. A prosthesis is an artificial limb substituted for a missing body part. An upper limb prosthesis refers to a prosthesis or device that replaces any part of the upper limb to restore the function and/or cosmetic purpose. This may include artificial components that replace the hand, wrist, elbow, and shoulder. Amputation levels for upper limbs start at the digits or fingers, as per the bottom row of this table, and then work up the limb all the way to the shoulder. Partial hand amputations can include a finger, ray, multiple rays, or complete hand. Amputations for these are usually required post-trauma, infection, or tumours. For partial hand amputations, there may be a small cosmetic device added to the hand, for example, a digit, or a more complex myoelectric hand, such as the one featured here. Transradial or below elbow amputations are one of the most common amputations and have the highest prosthetic acceptance rate, as well as having a multitude of options for prostheses. It is important, however, that 2/3 of the forearm are maintained to maximize function and prosthetic options. 5 centimeters of the residual length is required for prosthetic fitting, as well as maintaining elbow motion. Here you can see 2 examples of a transradial prosthesis, the lighter colored being a more cosmetic device, compared to the more advanced and myoelectric option in black. For upper limb amputations at the elbow or through the humerus, the preservation of limb length is both important for prosthesis attachments as well as the individual's ability to interact with their environment without a prosthesis. The size, shape, and durability of the remaining limb, as well as the appearance, are key in considering prosthetic options and assistive devices. Things to consider also include the length of the preserved limb and the soft tissue management and nerves involved. For shoulder disarticulations, these can be very complex injuries and amputations. With advances in technology, there are more myoelectric options starting to evolve, or hybrid options allowing for body-powered and myoelectrics to combine. Here, however, is an example of a body-powered device with a harness used for a shoulder disarticulation. For upper limb prostheses, there are 5 options which have been briefly discussed in some of the previous slides. These are aesthetic or cosmetic, oppositional, activity-specific, body-powered, and externally powered. The requirements of the individual need to be considered, and depending the type of amputation, the following should be discussed with the patient, including thumb function, activities of daily living or ADLs, type of work they are doing and the skills required, physical activity levels, social and leisure activities, with functional goals being the priority. Passive prostheses assist in balance, stabilization of objects such as holding down paper when writing, and recreational vocational activities. They look like a natural limb and are the lightest and cheapest, but they do not provide active hand and joint movement. Body-powered prostheses are the most commonly prescribed upper limb prostheses for individuals with amputations and limb deficiencies. They have been used for centuries and remain popular among clinicians and users. In contrast to externally powered prostheses, which draw power from an external source, such as a battery, to drive the motors of prosthetic components, body-powered prostheses use gross body movements to operate the prosthetic components. Body-powered designs have remained popular over the years because they offer more advantages over their other systems. They are low cost, lightweight, and reliable. Because the user can feel the cable tension and force during operation, body-powered systems offer a level of proprioception not generally available with externally powered prostheses. The cable strap system holds the prosthesis on and uses the motion of the person's shoulder blade and upper arm to operate the hook, hand, and/or elbow joint. Some systems use the opposite arm to trigger one particular function. One end of a strap encircles the opposite arm at the armpit, and the other end connects to a cable that controls the terminal device, which might be the hook, hand, or specialty device for a particular function. Externally powered myoelectric prostheses provide active hand and joint movement without needing shoulder or body motion. Sensors and other inputs use muscle movement of the residual limb or upper body controlled electrically powered actuators that provide greater grasp force than body-powered prostheses. Things, however, to consider when choosing this option include the availability, the weight, the cost, the cosmesis look, the noise, durability, wearability, compatibility, limb length, whether there is gadget tolerance, as well as environmental requirements. Hybrid prostheses are typically used for higher level upper limb amputations. They combine specific features of body power and myoelectric power. For example, a body-powered elbow might be combined with an externally powered hand or terminal device. Hybrid prostheses combine the advantages of both body-powered and externally powered designs, particularly for individuals with high-level and/or bilateral upper limb amputations. Hybrid prostheses may reduce the weight, provide simultaneous control of multiple degrees of freedom, reduce costs, increase grasping force and lifting capabilities, and/or permit finer control. Finally, activity-specific prostheses are for people who participate in activities that could damage the residual limb or everyday prosthesis, or when the everyday prosthesis would not function effectively. These prostheses often include a specialty design interface, socket, suspension system, and terminal device. Activity-specific terminal devices can allow the person to grasp a hammer and other tools, a golf club, a baseball bat, or hold a baseball glove. Others aid in various specific activities, for example, swimming or fishing. These prostheses can be passive or controlled by the amputee. The field of prosthetics is vast. With the development of the support worker role and an increase in awareness and educational resources, the support worker role will continue to develop. This presentation has been designed to help give an overview of the types of upper limb prostheses that support workers may be required to assist with, from manufacturing, for those undertaking the apprenticeships, to those working in a clinical support role. BAPO would love to hear from support workers specifically working in upper limb prosthetics to provide us with specific case study examples. For those wanting to pursue a support worker career in prosthetics and orthotics, more detail and education around the different devices will be provided as part of your on-the-job training. For more information or to access more learning resources, please contact BAPO at the BAPO website www.bapo.com. More detailed information about the types of amputations and prostheses for upper limb can be found in the Atlas of Amputations and Limb Deficiencies.